So my topic is about efficacy of intralesional bleomycin in treatment of orbital lymphangiomas. So as we know, lymphangioma, it's a benign hematomatous lymphatic tumor. So it's mainly because of the proliferation of anomalous dilated lymphatic vessels, which is lined by normal endothelial cells. So it was initially considered as a neoplasm, but ISSVA classified it as a combined vascular malformations. So it contributes 0.3 to 4% of orbital tumors, and more of female predominance is seen. So surgical excision is the mainstay of treatment, but due to the extensive infiltrative nature of this disease, complete excision is not possible, and it can also cause damage to the adjacent vital structures. And if it's not removed completely, recurrence is also very common. Therefore, non-surgical methods such as intralesional sclerosing agents have been tried. So in our study, we are going to see in 16 patients diagnosed with orbital lymphangiomas. So all the patients were diagnosed clinically and radiologically were included. All of them underwent detailed ophthalmological examination. MRI was done for all the patient. Systemic evaluation along with blood investigations was done. Serial photos were taken and documented during the course of treatment and follow-up. So the exclusion was hypersensitivity to bleomycin, impaired renal function test, pulmonary problems, pregnant and lactating women, and patients who lost to follow-up. So bleomycin comes in a 15 international unit dried powder. 1 international unit of bleomycin equals 1 mg of bleomycin. The ideal dose is 0.5 international units per kg body weight. Maximum it should not exceed 5 international units per kg body weight. So it is prepared in normal saline and along with 2% lignocaine in ratio 1:1. So lignocaine, it reduces the discomfort post-operatively. It also facilitates the dispersion of the drug, making the cell more permeable. So the volume which is injected into the lesion is usually 20% of the aspirate, and it should not exceed 5 ml per session. So for children it was given under general anesthesia, and the reconstituted solution is injected intralesionally with a 23 gauge needle with 10 cc syringe, and for deep lesions ultrasound guided was done. So the needle is kept in the same position and bleomycin was injected. So larger amount of volume, if it's injected, it can cause extravasation of the drug, poor dispersion, and even compressive effect. So repeat injections were given at 4 weeks, and treatment was discontinued after the maximum cumulative dose or after 3 to 4 injection, or when no further sign was resolution was noted clinically. And MRI for all the patients were done after 6 months, and patients were at follow-up for up to even a year of treatment. So from our results, out of the 16, 10 were females and 6 were males. 5 were under the pediatric age group, and all the patients had unilateral presentation. Proptosis was the most common symptom, followed by lid swelling. So the number of injections ranged from 2 to 4. 8 patients, that is 50%, had complete resolution with 2 injections, whereas 3 patients required 4 for a good satisfactory outcome. 2 patients had resolution after 3 injections but had recurrence after 6 months. And 3 patients, even after giving the maximum number of dose, there was no improvement, hence surgical excision was done. So in our study, not much complications were noted. There was no long-term or systemic side effects. So these are few patients. As you can see, there's an upper lid swelling, and post 2 sitting of bleomycin injection, there's complete resolution. This is another patient with lower lid swelling. Complete resolution is noted after 2 sittings. This child presented with proptosis, and after 4 sittings there was complete resolution, which was even confirmed radiologically. And this boy had a diffuse swelling in the upper lid, and after 2 injections there is reduction, and after 4 there is complete resolution. So this man, even after the cumulative dose, there was no resolution, hence surgical excision was done. So I'll rush through the discussion. As we know, in lymphangiomas, it's mainly failure of the lymphatic to connect to the venous system. So it usually remains silent clinically, and it enlarges very slowly. It causes proptosis, EOM restriction, and sometimes even compressive optic neuropathy because of the intralesional hemorrhage. In MRI, we can see the pathognomic fluid levels. So to differentiate it from hemangioma or AV malformation, there is absence of flow void or even feeder vessels. So bleomycin was first used as an anti-neoplastic antibiotic So it causes breaks in the single or double-stranded DNA. It inhibits the synthesis. It induces tumor necrosis factor and apoptosis. It was first used in 1977. So these are the adverse effects of bleomycin. Pulmonary fibrosis is very dose dependent, and it happens only when the cumulative dose exceeds 400 mg. So these are the multiple studies which showed very good results with bleomycin. Raichura et al. Reported a dramatic response in 13 patients with orbital lymphangioma. So in our study also, around 11 patients had a very complete resolution, and only 3 had recurrence, and 3 there was no improvement which required surgery. So the conclusion, intralesional bleomycin is a very effective and a safe method of treatment for orbital lymphangioma without any significant ophthalmic or systemic side effects. So it's a good alternative to surgical excision, where you cannot remove the entire mass as well, and when the patient is also concerned for cosmesis. So it can even be used as an adjunct surgical therapy to surgical debulking. So these are my references. Thank you.
Well, Dr. Sandhuja, your title is that efficacy of intralesional bleomycin in treatment of orbital lymphangioma. The pictures which you showed, 5 or 4 patients, out of them only 1 patient had orbital lymphangioma. Rest of them, they had periocular lymphangioma, which was not classically orbital. That was either in upper lid or in lower lid or in palpable conjunctiva or cornicial conjunctiva. So we are worried for orbital, true orbital lymphangiomas. What is the concern like giving bleomycin in true orbital lymphangioma?
Mainly compressive effects can happen, or even damage to the adjacent, because it's only for deep we can use ultrasound guided, but still, since it's a blind procedure, sometimes it can cause damage to the surrounding structures as well.
Surrounding structure means?
The important vital, the nerve, neurovascular bundle, or even the optic nerve as well.
How do you get effect of bleomycin? What is the basic pathophysiology? Why it is effective?
So it mainly causes the vascular endothelium.
Correct.
It mainly affects the vascular endothelium.
That is also contributory to the side effect. So there are vessels, important vessels in the orbit, and you can damage that. So that's why we are really worried for injecting bleomycin or any, for that matter, any sclerosing agent inside the orbit. But yes, it is a proven, well-tested methodology for periocular lymphangiomas, and it really gives wonderful results.
Thank you.